welcome to today's session wherein we shall discuss everything about cervical cancer. I'm Prachi, Head Nutritionist and Lifestyle Expert and Head of Cancer Vertical with Team Luke. As per the American Sexual Health Association, the month of September is regarded as Gynecological Cancer Awareness Month, which includes cancers right from cervical, uterine, ovarian, and so on. Today, our focus would be on cervical cancer. To begin with, cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. These are the parts of female reproductive system. It is the fourth most common cancer among women worldwide. Almost 99% of all cervical cancer cases are linked to an infection with high-risk human papillomavirus (HPV), which is an extremely common virus transmitted through sexual contact. Although usually most infections with HPV resolve spontaneously and cause no symptoms, persistent infection can cause cervical cancer in women. Cervical cancer is very much preventable and curable as long as it is detected early and managed effectively. Women with early cervical cancers and precancers usually have no symptoms. They often begin to appear only when the cancer grows in size and into nearby tissues. Symptoms seen then are unusual vaginal bleeding such as after sex, maybe between periods, after menopause, unusual vaginal discharge, or pain during sexual intercourse. If the condition advances, one may experience swelling in the legs, blood in urine, difficulty in urination, unexplained weight loss, fatigue, and so on. Screening for cervical cancers is of utmost importance for an early detection and cure. As per the American Cancer Society, screening should begin at the age of 25 years. It is done using pap smear and high-risk HPV testing. Now, a pap smear is a part of a women's regular pelvic exam. Your doctor collects cells from the surface of your cervix and a technician looks at them under a microscope. If they spot anything unusual, they will investigate it further. Usually, in terms of treatment for cervical cancer, surgery and radiation therapy are the most common treatments for invasive cervical cancers. Others are chemotherapy and certain biological therapies, including even immunotherapy these days. Let us now discuss how can we help prevent being contracted by this cancer in the first place. Firstly, WHO, that is World Health Organization, recommends taking HPV vaccine, that is a human papillomavirus vaccine, as per their guidelines. Now, while human papillomavirus is the primary cause in 99% of cervical cancer cases, other factors may influence one's susceptibility and response to this virus. Let us have a look at such risk factors. Risk factor number 1 is the use of conventional sanitary pads. Have you ever wondered that sanitary pads, which most women use every month during their menses, can also be a risk factor for cervical cancer? Yes, that is absolutely true. The conventional sanitary pads are bleached with some chemicals which give out a compound called dioxin, which is a harmful carcinogen, meaning cancer-causing agent. Hence, chronic exposure to this compound can pose you at a higher risk of getting gynecological cancers, including cervical cancer. Also, that fragrance that you get from these pads, which we think are so good, to help mask any unpleasant odor, this, by the way, is also a potential hazard when it comes to posing as a cancer risk and also, in fact, affect our hormones. How can we reduce the risk then? You can, in fact, use organic, biodegradable, unscented sanitary pads which are usually made out of bamboo or even cornstarch and so on. The next risk factor is douching. The word douche is French for wash or soak. It is basically a method that females use to wash out their vagina, usually with a mixture of water and vinegar. But vaginal douching could be one of the possible contributing factors to cervical cancer. Women who douche may choose from a range of possible solutions, including water, homemade vinegar mixtures, or manufactured chemically scented products. Some of these solutions contain potentially carcinogenic chemicals such as phthalates and volatile compounds. Douching may also impact cancer risk by physically pushing the pathogens, meaning the harmful disease-causing microorganisms that we call, including the viruses like HPV, up the reproductive tract. Or the mechanism could also be by washing off or washing off the and changing the microflora of the vagina, which usually helps protect from these harmful pathogens. Hence, it is best to avoid such practices. The next risk factor is possible use of genital talc, the use of talc at the genital area. There has been a positive association between genital talc use and ovarian cancer, but it could possibly contribute to cervical cancer risk as well. Now, talc, which is used in most of our talcum powders, it consists of asbestos, which is a potential carcinogen. In addition, the talc applied to underwears or sanitary napkins, chest, or directly to the perineal region can enter the vagina and travel up the reproductive tract, and these talc particles then may act as irritants in that area, resulting in an inflammatory response and thus potentially affecting a person's susceptibility and response to human papillomavirus infection. Hence, best is to avoid use of talcum powders which consist of talc. Instead, one can use organic cornstarch or arrowroot based powders if need be. The next factor to consider is vitamin D deficiency. We often tend to miss out on this important vitamin. It is essential not just for the bones but also for efficient functioning of our immune system and hormones too. Normally, our immunity helps ward off the high risk HPV, the virus in the vagina and cervix. But a low vitamin D level can majorly impact our immunity and thus increase the risk of cervical cancer. Due to our current lifestyles, being indoors or in the AC most of the times, we tend to be low on this crucial vitamin. Exposure to morning sunlight for about 30 to 45 minutes could help to an extent. However, the best way to keep up with the levels would be through oral supplementation, but only after knowing your vitamin D level through a simple blood test and then check the right dose for you with your doctor. The next factor or the risk factor is long-term use of oral contraceptive pills, that is OCPs, or the birth control pills that we call. There is good evidence by now that taking oral contraceptive pills, OCPs, for a long time increases the risk of cervical cancer. Research suggests that the risk of cervical cancer goes up the longer a woman takes OCPs, but the risk goes back down again after the OCPs are stopped and returns back to normal many years after stopping it. Hence, we need to be aware of this fact and talk to your doctor about other better ways of contraception. The next factor is smoking. Women who smoke are about twice as likely as those who do not smoke to get cervical cancer. As per studies, tobacco byproducts have been found in the cervical mucus of women who smoke, and therefore researchers believe that these substances damage the DNA of cervix cells and hence may contribute to the development of cervical cancer. In addition to that, smoking also makes the immune system less effective in fighting HPV infections. This is true not just in case of active smoking but also in case of passive smoking, which is breathing in the smoke if someone else is smoking in the vicinity. Hence, it is best to quit smoking for good. The next risk factor is unhealthy eating habits. Having a food routine high in refined white sugar, saturated and trans fat, and which is low in fresh fruits and veggies can increase the risk of cervical cancer. Presence of high levels of free radicals in the body, which are something that can cause damage to our immunity and our organs, can cause DNA damage and favor cancer formation, including cervical cancers. Hence, a diet which is rich in antioxidants which counter the effect of such free radicals is very essential. You get them through your fresh and seasonal fruits, veggies, nuts and seeds, and also having a balanced meal with whole grains and pulses, legumes is very important. The next risk factor is sleep deprivation. I always say that sleep is often underestimated and is considered non-productive by many. But that is absolutely untrue. We come across many such clients who do not pay attention to their sleep. They tend to sleep late either due to their work commitments or just watching Netflix. Sleep is extremely important because all of the healing, recovery, detoxification, hormonal balance that goes on in our body to build immunity takes place only while we sleep. And lower the immunity, higher would be the chances of HPV progression. Correct? In addition, sleep deprivation also suppresses melatonin, which is the sleep hormone and also an important anti-cancer hormone. Hence, a good quality and quantity of sleep is extremely essential to feel rested on wake up the next day. Try to also maintain a regular sleep pattern. The next and one of the a very important risk factor is deep rooted emotional stress. Many studies suggest that chronic emotional stress is related to high risk HPV infection and may thus play a role in HPV associated cervical cancer formation. We cannot separate our mind from our body and healing. Chronic deep-rooted emotions, suppressed emotions, examples of which are, betrayal by a loved one or child abuse or having low self-esteem for years. Emotions of resentment, guilt, extreme anger, suppressed of, emotions for many years or undergoing an ugly divorce and so on. Internalizing and suppressing such emotions chronically can manifest into something like cancer, as these emotions are not just emotions but they have a deep impact and weaken our immunity and therefore can pave the road for HPV infection and thus cancer. In fact, we had this case of a young 41-year-old female with cervical cancer who was undergoing an ugly divorce and had estranged relations with her spouse for the past 2 years before her being diagnosed with cervical cancer. We all have some or the other stressors in our life, but we need to find the right way to channelize these negative emotions and let it not affect our system. Many such techniques like meditation, pranayama, positive affirmations, visualization have helped a lot of our clients in achieving the same. You all too can definitely give it a try. So this was all about cervical cancer and how we can identify the risk factors to help prevent it in the first place. Because as we all know, prevention is always better than cure, right? To have a quick recap, we first looked at what cervical cancer is, its signs and symptoms, screening, how it is diagnosed, treated, and most importantly, what are the risk factors for the same, which included, of course, primary cause being HPV virus infection, but the contributing risk factors could be douching, use of conventional sanitary pads chronically, possible genital talc usage, vitamin D deficiency, long-term use of oral contraceptive pills, smoking, unhealthy eating habits, chronic sleep deprivation, and deep-rooted emotional stress. In case of any queries related to this topic or to know more about our cancer care program, do visit the Coutinho.com website. Thank you so much, everyone. Take care.